Hi, I'm Nathan. I was the attending paramedic on this case. Our patient is Alistair Wood. He's a 50-year-old male and his birth date is the 16th of the 7th, 1967. Now, Alistair was out playing golf today and he had only made it through one hole when he started to experience shortness of breath and also a tight pain in the central area of his chest. Alistair sat down to rest, however this did not relieve any of his symptoms and the pain persisted. Now, due to Alistair's previous cardiac history, this prompted his friend who he was playing golf with to call the ambulance. Upon our arrival at scene, Alistair was sitting upright on a bench. He was noticeably diaphoretic and also seemed to be in quite significant physiological stress. Alistair was clutching his chest and told us that he was experiencing quite severe pain in the central area of his chest. Now, he described this pain as a tightness and also rated it 7 out of 10 on the pain scale. Alistair also told us that this pain was more severe than previous pain he had experienced due to a previous diagnosed angina. This pain did not change due to inspiration or expiration, also did not change with palpation of the chest. Alistair also denied having any pain elsewhere on his body. Now, Alistair's airway was patent and his rest rate was slightly increased, however his breathing was unlaboured. Now, upon arrival, Alistair's BP was 160/92. His pulse rate was 112, but was strong and regular. Rest rate was 22. His chest was clear and had good air entry bilaterally. He was speaking in full sentences. His oxygen sats were 98 on room air. His ECG showed sinus tachycardia, however there were no ST changes. He was afebrile with a temp of 36.9. and his GCS was 15 with a strong bilateral grip. Now, all of Alistair's vital signs at the moment are stable and within normal parameters, and his BP is holding at 130/80. Now, because of concerns about this pain centrally in his chest and also the previous cardiac history, we decided to treat down the ACS guideline. So we administered 300 milligrams of aspirin, and because he has also received GTN in the past, we administered 600 micrograms of GTN sublingually, and we also applied a transdermal patch which is now on his right shoulder. After this, we asked Alistair his pain score again, which he said was still 7 out of 10 and had not relieved at all. So en route to hospital, we got ourselves IV access and we administered 5 milligrams of morphine, and also because 5 minutes passed, we also administered another 600 micrograms GTN sublingually. Now, when we asked Alistair about his pain now, he said it had dropped to a 2 out of 10, which we were happy about. But because we wanted to get it to 0, we administered another 2.5 milligrams of morphine. Now, this seemed to have worked because for the last 10 minutes, Alistair has stated that he is pain-free. And throughout this whole process, his BP held quite strong, so we have left the transdermal patch on. Now, Alistair has no allergies. He is on GTN for angina. However, he did not have his GTN on him today. He's also on lisinopril, furosemide, Valium, hydrocodone, and Lipitor. Alistair has a history of angina, which I said before. He also suffers from chronic leg pain due to arthritis. He has high blood pressure and also high cholesterol. And in 2011, he suffered an AMI. He has a history of smoking. However, he has stated that he quit smoking 6 years ago after his AMI. And he has also said he struggled with alcoholism in the past. However, he said within the last 12 months, he's had that under control. His GP has also suggested to him that he needs to lose a little bit of weight. Other than that, there's not much more I can tell you. Thank you for listening, and we'll hand him over to you guys. Thanks.